Good morning. Good afternoon, everybody. And welcome to this April's edition of the webinar of ILIFA and ILIFA La Bantwana, Reset and Data Drive. It's wonderful to have you. I can see you're coming in. We're just going to wait a few minutes until everyone has come into the room. Right, so we are privileged today to have Kelsey Harris. She is speaking to us today and sharing on her knowledge around early childhood development and really the vast experience that she has in this area. It's really a privilege to have her. So thank you, Kelsey, for joining us today. And she's joining us from the US, which is why we've shifted our usual time to 4 o'clock today. But Kelsey is a senior policy analyst at the Center for Global Development in the Gender Equality and Inclusion Program. And she's been working in various policy and advocacy roles in gender and international development and immigration in Washington, D.C. And she has extensive expertise in coalition building and project management. And before joining the CGD, she was the acting director of policy and advocacy at the International Center for Research on Women, where she managed We Prosper, a global coalition on women's economic empowerment. And prior to that, she held positions at Interaction and the American Immigration Lawyers Association. And she holds a master's in public policy from George Mason University in Arlington in Virginia, and a bachelor's of arts from the University of North Carolina at Chapel Hill. Kelsey, with no further ado, I hand over to you. And thank you very much for joining us today.
Thank you, Dr. Wills. It is my pleasure to be here with you all today. And I just really want to thank you all for hosting this event and also for providing this opportunity to share this research. So today I'm going to be sharing some insights from a recent CGD policy paper, which examines public expenditures and policies on childcare and early childhood education and development in 4 specific countries: Côte d'Ivoire, Kenya, Rwanda, and Senegal. And I'm coming at this from a bit of a different perspective from many of you, I believe. I know many in this webinar are focused on early childhood development and children's outcomes, but at CGD, we're working to look at childcare from the angle of women's economic empowerment, given its importance to driving women's outcomes and empowerment in the economy. So I'm going to be giving a high-level overview from this recent policy paper, but I also want to point you to this paper because, you know, we only have so much time today. So we have the paper and we also have a blog, which my colleague Asta Mainali will hopefully be able to share in the chat, but if not, we'll also make these slides available so that you can take a look and dig in a bit deeper. For a bit of an overview of this presentation, first I'm going to talk a little bit about why it's important to review public expenditures on childcare. From there, I'll go into some of the methodology and data considerations that we encountered. Then I'll provide an overview of the findings, talk through some key policy recommendations, and then give some reflections and conclusions before opening it up to questions from you all. So first, the question, why review public expenditures on childcare in ECD? One of the primary reasons we were interested in delving into this data is because of the clear linkages between access to quality childcare and women's economic empowerment. As I'm sure many of you know from personal experience, women are typically the primary caregivers for children. So provision of more and better childcare and family-friendly policies not only improves women's labor force participation, but also reduces employment-related gender gaps. We also see that childcare promotes better jobs and decent work, increases unpaid care work, and also improves women's well-being. And of course, all of these benefits are on top of the extensive developmental benefits for children as a result of care. Additionally, governments have a central role in financing childcare and social protection, but right now there are significant gaps in provision. So in doing this research, we wanted to learn more about the current spending levels, specifically who is being reached, where we still see gaps, and then we wanted to interrogate how to help fill those gaps. But this is no easy task. As many of you know, childcare is a complex and multi-sectoral space, and data gaps and challenges are intensified in low and middle income country settings. But it's critical for us to delve into this data and to understand more about the fiscal role that governments are playing in the ECD and childcare space. This knowledge will help us to promote effective and inclusive policies and also figure out how to maximize investments moving forward. Just briefly want to talk through the methodology and data considerations. And again, this research is focused on spending in these 4 African countries: Rwanda, Senegal, Kenya, and Côte d'Ivoire. And these countries were chosen because they have available and reliable data on pre-primary education and social protection. We're also trying to select countries to give a diverse representation of spending across both East and West Africa. So this is not meant to be a comprehensive representation of sub-Saharan Africa, but rather we're hoping that this can provide some more detailed insights, which can then inform a broader discussion around spending in sub-Saharan Africa. So we utilized secondary data from the ILO, UNESCO, the OECD, UNICEF, and the World Bank. And we looked at a few different spending components. The first is what the government is directly spending on childcare domestically. The second is any foreign aid that is going to ECE. And then the third is the policies that are influencing that spending. Finally, we took a look at a new tool, the ILO's Care Policy Investment Simulator, to provide some quantitative insights into what the costs and benefits would be to fill the current care policy gaps based on that spending data. Before going into the data and analysis, I think it's important to first lay down some definitions. There's a lot of different terminology and acronyms in this space. A lot of them are very similar. And there's overlap between the terms, but there's also some really significant distinctions. So I first want to clarify, when referring to some of these acronyms, what I mean throughout this presentation. So first we have early childhood development. This is a broad term that refers to multidimensional child development interventions across nutrition, health, safety, care, and education from birth to age 8. Then we have early childhood care and education, or sometimes it's referred to as early childhood education and care, so ECCE or ECEC. And this includes both care and education components for ages 0 through 8, but often we see this focusing more specifically on the pre-primary education age from ages 3 to 6. Finally, we have early childhood education, which is more singularly focused on education for ages 0 through 8. So this includes both pre-primary education and also primary education up to age 8. Comparatively, we talk about childcare, and this is less defined than all of these areas, but we refer to it as essentially care for children under 6 years old. And funding for childcare, when we talk about funding for childcare, there's no sort of specific line item for childcare in budgets. Often we see funding through either ECD, ECEC, or ECE budgets and spending. And then in addition to those sort of budget line items, there's other important components of childcare related to family-friendly policies. So this could be maternity leave, paternity leave, family leave, and sometimes this is publicly provided and ensures that parents are able to directly provide care for their children. And then this falls within another component of the budget in social protection. So the spending data across all of these areas is sort of categorized inconsistently and incoherently across different contexts, different geographies, different levels of government. So it can be difficult to understand where all of these allocations fall. Another important point on data. So because the data on childcare is not comprehensively collected, our analysis utilizes pre-primary education spending as a lower bound estimate of expenditures on childcare, as that is the data that is consistently available and reported. However, this should be understood as a non-comprehensive picture of childcare spending, as care for children aged 3 to 6 is very important, but it does not fully encompass the care needs of women or children. A few other data challenges to point out when we encounter the sort of data landscape of childcare and ECD. First is inconsistent reporting. Even when looking at pre-primary education, the data that's most available, this spending data is still reported inconsistently. Some countries report this data every year, others do not report it at all, and some have a long lag between reporting years. So one of the countries we looked at was Kenya, and the data that we have for Kenya is from 2015, so it's a decade old. It's also not easy to extrapolate childcare spending from the fragmented budgets and spending data that we have. Childcare in ECD is spread over many different sectors and agencies: education, social protection, health, gender, etc. And then within that, there's varying definitions by different governments or in different contexts of what's included in ECD and childcare, which adds this additional level of complexity. And then finally, despite the fact that childcare spending covers a wide age range of children, typically 0 to 8, we often do not see disaggregation by age or by sector. So sometimes even if we have the data, it can be difficult to fully understand. All right, so moving on to the findings with all of that context in mind. The biggest takeaway from this research is that there are large gaps in both domestic spending and foreign aid for pre-primary and early childhood education, particularly as compared to globally agreed upon targets. So again, in looking at the 4 countries studied, we have Côte d'Ivoire, Kenya, Rwanda, and Senegal. We found that less than 0.2% of GDP is spent nationally on pre-primary education. And this is compared to a globally agreed upon goal of 1%. And then we found that less than 2% of national education expenditures are being spent on pre-primary education. And this is compared to a global goal of 10%. Looking to foreign aid, we found that bilateral foreign aid to ECE is less than 0.7% of education aid, and this is compared to the global goal of 10%. And then finally, foreign aid to ECE as a percentage of education aid is generally 2% or less, but we do see this jump significantly where there have been some cases of large multilateral investments. Just to take a closer look at spending levels, here is a graph of spending on pre-primary education and education as a percentage of GDP in these 4 countries. So that's the first 2 bars for each country. And then the last bar is the percentage of the education spending that's spent on pre-primary. So here you can kind of see the comparison between the 4 countries, and then take a look at the global targets in comparison. Again, the ILO's global target on pre-primary education is 1%. The target for the amount of education spending that should go to the early years is 10%, and the spending levels in these 4 countries fall far below that. Hopefully you can see the numbers here, but you can see that Rwanda has a spending of 0.12% of GDP on pre-primary education. That's the highest of the 4 countries. Côte d'Ivoire has the lowest, and the same sort of ranking, for lack of a better word, goes for the percentage of pre-primary or the percentage of education going to pre-primary education. Here we have Rwanda standing at 2.4%. compared to Côte d'Ivoire at 1.5%, and still, even with Rwanda at 2.4%, this is less than 25% of the global target. It's also interesting to bring in the education spending into this comparison. That's the gold bar in this graph. As you can see that even when we see education spending that's relatively high, as is the case in Senegal at 6% of GDP, this does not necessarily translate to an equivalent prioritization of pre-primary education. You can see that even with that higher level of education spending, the pre-primary spending in Senegal is quite low at 1.7% of the education budget. And speaking more broadly, this level of spending is very typical in sub-Saharan Africa and also similar to levels found in Asia in the Pacific. Unsurprisingly, we also found that many higher income countries are spending more in these areas. So, for example, the OECD has an average of 0.8% of GDP going to ECEC. That's still below the 1% global goal. But then we also see some global North countries that are not prioritizing pre-primary education, with the US and Australia only allocating 0.3% of GDP. One other caveat when talking about these spending levels, while this does help to give us a better sense of the prioritization of pre-primary education, there's a lot that the numbers don't tell us. For example, it does not tell us anything about the quality of the care or education, or about the outcomes for women and children. And this is only looking at the public spending, of course. There's a significant amount of household spending that's happening in most contexts, often because of low levels of public investment. And this research did not analyze the levels of private spending, which poses its own data challenges. However, this could be a potential avenue for future research as more of that data becomes available. Just to point out that the last graph was a representation of a particular year in time. But when we look at pre-primary education spending in these 4 countries over a more extended period of time, this graph is from 2010 to 2023. It's also important to note that we see significant fluctuation between years. So while with the most recent year's data, we see Rwanda having the highest level of spending and Côte d'Ivoire having the lowest, this has not been a consistent phenomenon. So you can see the fluctuations between years and gaps in data when you look in this sort of extended time range. Taking a closer look at foreign aid flows, we do see a bit more consistency across these 4 countries prior to 2019. But then we also see these interesting spikes in spending in Rwanda and Côte d'Ivoire. So on the left side, this is just millions of US dollars to ECE. And then on the right side, this is a calculation of the percentage of education foreign aid that's going to ECE. And we see spikes in both of these graphs. And this is in great part due to the launch of the Invest in Childcare initiative at the World Bank, which was around 2020. This is an initiative which has already channeled millions of dollars to dedicated and integrated childcare related projects at the World Bank. And both Rwanda and Côte d'Ivoire were amongst the recipients of some match-funded recipient-executed grants related to childcare, which means that we are seeing this large increase in their funding during these years. But, for example, looking at Rwanda, which is this darker blue line on both graphs, we see a drop after that initial infusion of funds. So this also certainly poses some concerns about sustainability of this funding over time. One last point on spending levels. It can also be helpful to conceptualize the public spending on childcare within the levels allocated to a child across all of childhood, essentially from birth to age 18. UNICEF research has found that increased spending in the earliest years leads to the greatest returns and better outcomes. But what we find across most African and low middle income countries is that spending is lowest when the child is youngest and then increases over time, the opposite of what we would see ideally. In fact, in low and middle income countries, an average of only $1,664 US per child is spent before age 6, and only $63 of that is spent before age 3. So this puts a lot of pressure on the education sector later in the child's life. And in our focus countries, we see exactly this phenomenon. So we see what's called a backloaded profile, with the spending in the later years of childhood being the lowest and then increasing over time. Our second major finding is the importance of strategic and coordinated policies to address the care needs of children under 3 and empower their caregivers. And to get a sense of the policy and legal landscape in these countries, we looked to the World Bank's Women, Business, and the Law survey data, as well as the ILO's Global Care Policy Portal, which aggregates details on national care-related policies. Of course, all of this is delineated in more detail in the paper, but just to speak broadly, we found that the focus countries had major gaps in their childcare, supportive, and legal frameworks, particularly compared to that of parenthood, but they did fare better than sub-Saharan Africa overall. We also found a slight variation in the policies across the focus countries and a shared lack of statutory childcare systems. So you can see in the graph on the right, this is the duration of maternity and paternity leave, as well as the, skipped forward, as well as the gender gap in childcare related paid leave and the childcare policy gap. You may be a bit curious about what I mean when I say childcare policy gap. Essentially, this is the time when parental leave policies end and universal childcare begins. So if the parental leave is, for example, 6 months, and then the preschool starts at age 6, we would say that the childcare policy gap would be 5.5 years. And here in the focus countries, you can see that Kenya, the childcare policy gap is this lighter blue bar on the end. You can see that Kenya has the smallest childcare policy gap, and Rwanda has the largest at 6.75 years. One encouraging development on the policy front is the presence of ECD policies in the focus countries. This approach promotes social protection and holistic child development. However, with the focus on ECD, we often see that the youngest children are left out of these policies. Additionally, it's unusual to see this integration of women's economic empowerment outcomes, but this adjustment could make a huge difference. For example, through Rwanda's National Early Childhood Development Program and Vision 2020 UMERANGE program, the government has taken a really concerted approach to improve ECD. They've prioritized creating 31,000 community and home-based ECD centers and set a goal to increase pre-primary enrollment from 35% to 65% by 2020. This has already resulted in more children attending ECD centers and pre-primary school, but it still does not address the care needs of children younger than age 2. So integrating this age group into the policy and programmatic approach could see significant benefits for both women and children. The last key finding is that we see significant returns from investment to close the care policy gaps. So in the 4 countries reviewed, as noted, we see the gap between 5.7 to 6.75 years. And putting that in the context of the African continent, you can see that this is pretty typical. So most countries in Africa have a childcare policy gap on the larger size. So this lighter blue color, or this sort of like blue-gray color, is between 5 or 6 or more than 6 years, and that's most of the continent. And then there are a few countries that have smaller care policy gaps of 2 or 2 to 3 years. But all of our focus countries that are marked in this sort of gold star are all above 5.5 years. So to close this childcare policy gap by 2030, an additional investment of 1% of GDP per year will be necessary. And that's to 2030, but if we look out to 2035, it would be a bit less than that. Of course, 1% of GDP is a large increase from current spending, but it could result in significant benefits. So you can see the full spending simulation in the graph here. And you can see that Kenya needs the most investment and Rwanda needs the least. A lot of this is due to sort of population dynamics. But as a result of this infusion, we could see millions of new jobs, and 65% of those would go to women. With those jobs, this could also generate economic growth with a return of up to $2.80 for every dollar spent on childcare. And this would also put us closer to achieving gender equality, as these investments in childcare could also reduce gender employment gaps by up to 6.6% and reduce the gender gap in monthly wages by as much as 33%. So with these 3 findings and the associated data in mind, this brings us to policy recommendations and next steps on investments and policies, as well as data on childcare and ECD. First, it's important to utilize the tools that we already have at hand. There are methodological ways to estimate spending on ECD across the government, across all these different sectors. And this level of insight can provide clarity to governments, particularly around these funding gaps and opportunities. There's also the ability to conduct more comprehensive expenditure analyses. And this has been done in South Africa, which some of you may be familiar with. This would be incredibly helpful information, but it's also very time consuming and can be expensive to do that. So in order to conduct this analysis, it's important to also utilize partnerships, including between the government, multilateral organizations, and research organizations. And then as a result, this information can help to optimize future budgets and align those budgets better with the government's policy priorities. We also need to expand tools and the evidence base specifically for sub-Saharan Africa. For example, we utilize the ILO's Care Policy Investment Simulator, and currently that only has a handful of African countries included. So adding more African countries and more low and middle income countries would facilitate additional comparative analyses and help governments and other stakeholders to understand the costs and benefits of filling care policy gaps. Another component is data related to the supply and demand of childcare. And this includes non-public options like home-based childcare or private daycares. This data is critical to inform childcare financing decisions, and right now is sparse. The next set of recommendations is focused on data transparency. So when we were doing this research, it was sometimes very difficult to find any budget or expenditure data on childcare. And this data needs to be more public and accessible. Additionally, there should be an effort to publish better disaggregated data on childcare and ECD, particularly for children under 36 months, as that's where we found the biggest data gaps. It's also important that this data is regularly reported to international organizations that collate this data across different countries, such as UNESCO and the World Bank. We also want to see improved foreign aid data on childcare. Right now, the ODA metric is specific to early childhood education, and this excludes some elements of childcare and ECD. We recommend that a more comprehensive indicator should be introduced. And to facilitate some of these changes, governments can also look to peer governments and international organizations for guidance. Some countries are doing a great job of publishing and disaggregating data and may be able to share some best practices. The third set of recommendations is critical. Childcare and ECD need to be better prioritized in budgets and spending. So essentially, we need to see increased investments for care for children under 6 years old, particularly for those under 3. And this might mean some difficult budgetary decisions given increasingly tight fiscal space. But given the evidence showing the increased economic benefits to investments in the earliest years, it's worth considering if increased investment or reallocation is possible. We also need better clarity on the inclusion of ECD in budgets and spending. This can allow for better, ideally disaggregated reporting on child care spending, and it can provide insights on areas of overlap and future coordination. We also recommend that foreign aid be increased for early childhood care and education. This, I also acknowledge, is going to be a more challenging recommendation to implement as we see foreign aid cuts across the board. But it makes it no less important as donor governments are grappling with where investments can be made to see the biggest impact. And then finally, in these financing decisions, it's incredibly important to ensure the use of a gender lens. When we talk about childcare and early childhood development, it's often solely at the benefit of children's development. While this is no doubt important, these investments have such significant impacts on the outcomes for women's economic empowerment. So this needs to be recognized and harnessed in making the case for these investments and in determining how to implement them. Moving on to policies, this last set of recommendations is essentially around coordination and strategy. So first, I mentioned the emergence of ECD policies in the focus countries. This is wonderful, but what we really need are policies that include ECD and women's economic empowerment. And this will involve better coordination across different agencies involved. For example, this could be done through a cross-sectoral ministerial working group. In some contexts, those with ECD policies have already had success in this cross-ministerial approach, particularly when there are very clearly defined roles and sufficient financing to match the ambition of the policy. So the recommendation is to take this approach and go further to make sure that women's outcomes are also included. The development and implementation of national care policies can also be another tactic here. Kenya has been developing a national care policy and working to have it approved by the parliament, but this only works if you have alignment, coordination with existing policies, and also financing. And then the other recommendation here is around realistic spending plans. It will not be easy to increase spending by the levels of the ILO simulation. In the context we looked at here, this is a 10 times increase. So a realistic strategy is needed to increase spending over time. And this can be done a number of ways. It can be through leveraging foreign aid, through multilateral grants or other low interest loans, by making policy changes like expanding parental leave, and by partnering with external stakeholders. And a discussion on whether or how to increase spending has to be one that balances both the cost, but also these extensive long-term economic and social gains. So just a few final reflections. First, I want to emphasize a couple of limitations that I mentioned earlier in the presentation. This analysis and the recommendations presented are based on the data that we have available, which is generally limited to pre-primary education expenditures. So this is an incomplete picture, and we need to keep expanding the picture so that it's more accurate. And researchers need to keep shedding light on where public expenditures on ECD and childcare stand. The other caveat is around unpaid care. Expansion in public financing of childcare helps to reduce and redistribute unpaid care, but more needs to be done to recognize it. While unpaid care work is not included currently in GDP calculations, hopefully as unpaid care and domestic work becomes better integrated into national statistics, there will be more opportunities to conduct analysis that better incorporates these measures. And then finally, we're about to open up for questions, and I'm really looking forward to your thoughts. But I'm also very interested to any reactions that you have to this research, any reflections, particularly if you're based in these focus countries or in other sub-Saharan Africa countries. I'm also very curious to hear any ideas you have about how this research could be utilized and built upon moving forward. And yeah, I hope that this isn't the end of the conversation too. So I want to share my contact information here. I encourage anyone to reach out if you have further questions or if you want to talk further. And I think I will pause there and turn it back over to Dr. Wills. Thank you so much.
Kelsey, thank you for yeah, very informative and such a clear presentation. It's really interesting to think about these issues beyond South Africa. And I think often we don't think about our situation in the context of the African region in general. And I think it's an important one. Also because I think a lot of what happens also in South Africa can often shape and inform things that happen in neighboring nations as well. So placing things in the context of the continent is really helpful for us. So thank you very much for doing that. We have only one question so far that's in the Q&A. Please, can you put your questions in the Q&A if you have? And we will start with them there. There is one so far, and it's from Salim Mukadem. And he asks, do you know why in Kenya paternity leave is more than maternity leave? That's a question we have. And then there's another question from Nettie about, I think it might be specific to South Africa. Do you know of new policies that support education, specifically ICT implementation within our country? I think it's a slightly more diverse question. But perhaps if you have a response to the first, that would be... Could
you repeat the second one more time?
Do you know of new policies that support education, specifically ICT implementation within our country? That's something that came up in the chat, but I don't think it's specifically related to ECD.
Yes.
If there are any other questions, I haven't seen any coming through yet, but I think as you get going, they will come through, and I certainly have some questions too.
Great, sure. So I can start with the first one. The question was why the paternity leave in Kenya is higher. And I wonder if it's helpful to share that slide again, or I can just talk through it. So what we find is that paternity leave in all countries is still sort of dismally low. In all of these countries, it's kind of hard to put it on a graph because, you know, we're looking at days, not weeks. So in Kenya, we have 13 weeks of maternity leave and we have 14 days of paternity leave, which is actually very high for really any country. And that's around what the ILO recommends as well. So, you know, for the other countries we looked in this study, you know, we've got only 1 day in Senegal, we've got 2 days in Côte d'Ivoire, 7 days in Rwanda, and then 14 in Kenya. So it isn't a huge range, but it is a range. And I think Kenya is starting to recognize the benefit, as well as other sub-Saharan Africa countries, of this more co-responsible model of parenting. So this is a shift we're seeing across the board. I'm not sure about the specific circumstances why Kenya has increased it to 14 while others are still, you know, in this 1 week or less range. But another phenomenon that we're starting to see that's related and perhaps important to mention is this move towards shared parental leave. So instead of just having maternity leave and just having paternity leave, some countries are also having a shared unit of leave, which can be split by both parents. And one recommendation there is to ensure that the mother just doesn't end up taking all of the leave, because the idea in having a shared parental leave system is that, then the responsibilities of caring for the child are split by both parents. So in some countries, we're starting to see a policy where you have non-transferable portions of that shared parental leave. So say it's like 4 months of shared parental leave, and 1 month has to be taken by the mother and 1 month has to be taken by the father. And the last 2 months can be taken by whomever makes the most sense. So that is another sort of trend that we're seeing. But in terms of why Kenya is slightly higher, yeah, unfortunately, I don't have any specific details on that point. To the second question, unfortunately, I didn't take as close of a look at South Africa's education policies. And I know that there are many from South Africa here on this webinar. So perhaps if anyone else is more familiar with new policies supporting education in South Africa, you might be able to pop some ideas in the chat.
Thanks, Kelsey. We've got various other questions coming through here. There's one from Colin. You mentioned that there was a spike in spending in Rwanda in 2020. What are the risks about sustainability if spending drops? And then there is another question from the same, also from Colin. He asks, and one more question, how do the ECB policies in LMS in low middle income countries compare to high middle income countries? So those are 2 questions from him. Perhaps you want to take those first, and then I'll go through the rest.
Sure. So the spike in spending in Rwanda in 2020 that I mentioned, so this is related to the foreign aid and multilateral aid spending over time. And essentially in Rwanda, in 2020, there was this large injection of aid. So there was like $52 million, whereas in past years, it was closer to like 1 or 2 million. And then we saw in 2021, this dropped down to around 9 million. And then most recently, it was closer to like 3.5 million. So we see this like huge cliff. But these high levels are, bottom line, not sustainable for longer term. It's great to sort of inject money to sort of help build policies and systems. So, in a lot of ways, it's great, but there does need to be a plan for what happens after that spending is gone, and how the government or, other stakeholders and partners, such as the private sector or, community-based organizations, are able to step in and support and build on the investments that have been made. So I think there are definitely risks, because a government can become reliant on these infusions of funding, especially when they're as high as what we're seeing here. And I think, we've seen a very similar spike in Côte d'Ivoire recently, with a $53 million injection, again, due to the Invest in Childcare initiative. So I think that there's concerns, but I also think at the same time that it's important to see this prioritization of pre-primary education and childcare in these multilateral institutions. So I think what the World Bank is doing in that regard is really wonderful and important, but hopefully over time we see some clear plans about sustainability and maintenance of the programming and policies that are put in place as a result.
Thanks very much. Right, there's another question from Gopal. What elements qualify as unpaid care, and how should they be accounted for when including them as a component of GDP?
That's a great question.
Yeah, perhaps you want to just start with that, and then there are a few
Sure.
more.
Sure. So unpaid care, this has been sort of some terminology that's become more mainstream, especially in the gender equality and women's economic empowerment space coming out of COVID. And unpaid care is basically care that women or other family members are providing that's not compensated. So this is providing care to your children. This is providing, and it's not limited to women. It can be any family members, but we often see these care responsibilities sort of falling to women as a result of social and gender norms. So it could be caring for children. It could be caring for family members that require more, that have more long-term care needs. It could be providing care to aging parents, which may be in the household or maybe outside of the household. But unpaid care is also outside of just direct care. It's, caring for the home itself. It's, going to get water to make sure that you're able to care for your family members. It's cleaning, it's cooking, it's, going and traveling to pick up your child from daycare. So, there's some really interesting statistics using time use data in tracking the levels of unpaid care that we see. And essentially, women are spending many more hours. I think it's like more than 3 times more than men on that unpaid care. And as a result of spending that time on unpaid care, they are less able to contribute to the economy in paid ways. And in addition to that, it is more difficult perhaps for them to have a formal sort of traditional 9-to-5 job. So many women may rely on more informal means of, receiving an income, or they may rely on part-time work. So there's all of these sort of implications. This is the long response to this question. So the question is how to include it in GDP. And the answer is we have to count it. So this unpaid care, these are economic contributions that need to be recognized. And so when we look at a country's GDP and we're saying, like percentage of this as from the GDP, none of those economic contributions are being counted. And this is mostly the contributions of women, again. So one thing that researchers are doing and governments are doing are including questions about how women are using their time in household surveys, for example. And so they're trying to get a better sense of how much unpaid care there is. And then there's proposals out there, especially in the feminist spaces, to then include that time within GDP calculations. And I won't go into all that, and perhaps we can share some resources afterwards from those that are more focused on this. But essentially, it's counting the time and then including it in this broader calculation of GDP.
So, I think in the context of South Africa, Kelsey, there's no doubt. I think COVID in particular really raised this issue around the cost of unpaid care in South Africa. And I think globally, there was no doubt, but there was definitely a period which really highlighted this. And we just saw the impacts of this here in South Africa as a major issue, and the impacts on women of having to look after children. I think that really was really brought it to the fore. But related to this question we just had, there's a question from Victoria Duncan, and she asks, would there be a way to include business or private sector expenditure, excluding private households? I think this is probably also excluding the unpaid care component. And would there be a way to include those into the calculations of total ECD expenditure per country?
Yeah, it's a great question. This is something we looked into, but unfortunately, this data is just not public. So I think there needs to be a more concerted effort to publicize this data and to align it with the public expenditures. I think ideally we do include this so we have a full picture of spending. And perhaps some institutions that are collecting the data on pre-primary education like UNESCO could, and maybe they already are, but not that I've found, they could help to facilitate this collection and collation. But I think this is a really important component. And in most countries right now, the private childcare provision, that's sort of the main mechanism for provision of care, in addition to sort of the unpaid care that we see. So yeah, I would love, especially if anyone has any ideas as to how to include this data. I think it's a really important thing to note.
All right, so another question from Cindy. Thank you for the great presentation, enjoying reading the paper. Why did ECD spending stagnate around 2016 in Kenya? It seems to coincide with devolved governance.
It's a great question and a huge gap. I don't know why ECD, well, let me back up. The only data that we have is from 2015 for pre-primary education in Kenya. So I actually just checked earlier this week to make sure that additional data hadn't been released since we published the paper. But the latest data for Kenya is the pre-primary education expenditures from 2015. So it's just this huge gap in knowledge. We have all of COVID in there, and we don't know how the spending has evolved since then. So I think, for speaking from like the policy advocacy and engagement side of things, this is something that we really need to engage our governments on, is this sort of accountability and transparency to make sure that this data is being shared and published, because it's important for us as researchers and policy advocates to be able to look to that data to evaluate how things are changing over time. But right now, it's just a big gap, and we aren't certain what has happened in that decade of time.
Thanks for that. Right, and a question from Nazia. Do you have some more insights into why the childcare policy gap is, I think, so much in Rwanda, or high, perhaps? It is only because of a lack. Is it only because of a lack of government investments, or are there any other reasons as well?
Sure. So the childcare policy gap, again, that's going to be the gap between the parental leave and then when statutory or public care systems begin. So a larger gap is going to be because likely either pre-primary education starts later. So in some places it could start at age 3, in some places it could start at age 6, age 7, or it's going to be because the parental leave doesn't go for as long. So in Rwanda, I will have to look back, but I think it's because the pre-primary education starts later, because the maternity leave is 14 weeks. And that's very similar to the other countries we looked at in this analysis. Kenya, Senegal, Côte d'Ivoire, all around 13, 14 weeks. So because the gap is higher, I believe that's because the pre-primary education starts a little bit later. And the way that gap could be filled is if, perhaps they add another year to pre-primary education. So instead of starting at 7, it starts at 6 or 5 or 4. Providing free government childcare, providing sort of cash benefits to parents for care, or expanding the parental leave is another mechanism. So there's lots of ways to fill that gap, but I believe in Rwanda's case, that's the reason for the discrepancy.
So Kelsey, there's a question from Hopalang, and she asked the question, I'd like to know, in the countries you looked at and any other evidence, whether governments recognize early childhood education or early learning programs as an enabler of job creation for women who provide them. And if so, how are they investing in or supporting these programs, especially in low-income communities?
Yeah, that's a great question. And I think we're starting to see more of this recognition of ECE as an enabler. For example, I mentioned Rwanda, and they're starting to incorporate these sort of gendered aspects into policies. Could you repeat the end of that question in terms of investment? What was the exact request?
Let me just find it again. Yeah, so, and if so, I mean, so basically, do these governments recognize early childhood education or early learning programs as an enabler of job creation for women who provide them? And if so, how are they investing in or supporting these programs, especially in low-income communities?
Yeah, I mean, I think there's a range of ways that these programs can be supported or invested in. You know, the World Bank is again sort of pouring money into this and trying to make the connection between ECE and women's economic empowerment. The government can also try to make these connections when funding sort of jobs and social protection programs. So again, I think it's just important to have a gender lens when considering these investments. A lot of the investments are happening, they're just not including that component or lens. And would love to like Hobagang, I feel like we could talk further about this, but just in the time allotted, you know, maybe we could take it offline and have a further discussion about different ideas in that regard. But that's a great question. Thank you so much.
Thanks, Kelsey. People are really testing you this afternoon.
Yeah.
And there are a few more to go, but we probably have only time for two. But there's a question from Chantal. While we now know the spending or budget allocations to ECD, how are these spending allocations related to better child health or learning outcomes? I think that's obvious. I think it's an important question, and I had this similar one.
Mm-hmm.
And what are the outcomes that will illustrate that the spend is having a positive outcome for children? In South Africa, more spend in health is not showing better health outcomes for children, question mark. What are the outcomes that say children are doing better when more money is allocated? Perhaps this question also relates to also the return on, you mentioned UNICEF report or work on return on investment. Perhaps it also relates to that, yeah.
Yeah, that's a great report. I would refer everyone to look at. It's called Too Little, Too Late. It's the UNICEF report from a handful of years ago. And it talks more about the children's outcomes component. Of course, again, like I mentioned, the spending data does not tell us anything about these incomes. And so I think further research really needs to be done in this regard. And from my perspective, we're looking at more the women's outcomes side of things. So I think there could be some interesting collaboration and discussions on this moving forward. So I don't have a great answer to this question, but I would suggest taking a look at that UNICEF report. And then again, I think this is just something that all of us as researchers and advocates need to continue to interrogate and think about, you know, not just the children's outcomes component, but how to connect that together with the women's outcomes, because they're just so intertwined.
Okay, we've got two more questions, Kelsey. There's a question from Ruben. Do you think the lack of available data around early childhood development weakens the investment case for increased government spending on early childhood development? And then lastly, a question from Zakona. What work is being done in terms of the care economy in South Africa?
Sure. Yeah. To the first question, I think, yes, this lack of data does weaken the investment case. We need to know sort of where things stand to make the case for more investment. We have no data about what investments are being made. It's hard to say we need more investment because we just don't know what the baseline is. And that's the case for children 0 to 2 in particular. So I think we need to continue to interrogate that. And then the question on South Africa in particular, I apologize, but this was not a country that was the focus of this study. So for those of you that are based in South Africa that may be able to answer that better, I encourage you to do so. And I would love to also receive any resources in that respect as well. So thank you so much for that question. Apologies, I can't shed any light on it.
Great. Kelsey, thank you so much for giving up your time today. Thank you for everybody for shifting your time as well in South Africa and being with us this afternoon. It's really been a pleasure to have you. Thank you for your engagement. Thank you for your really deep questions that have been presented as well to us. And we look forward to having you again. In May, there will be again another webinar. And this is going to be by Dr. Jessica Haller. and that is on titled Using Systems Thinking for Program Theory and Evaluation in Early Childhood Development. So we look forward to seeing you again next month. And till then, take care, and we hope that things continue to move forward in the right way for children across our continent. Thank you. Bye-bye.
Thank you so much. Bye.